Hello, you guys. Good evening. Happy Wednesday, and welcome back to our Connected interview series. I have said and promised that what I want to do is bring to you guys some of my connections, because I have amazing connections like Shannon Miles here, who I get to talk to on a regular basis, and many of the other people that have been on here prior that I get to share with my patients and also the public some of their professional views, which is awesome. Because of course, we can't do it all. And people kind of run around like a chicken with their head cut off, figuring out like, what's the best? Where's the priority? What am I missing? How do I get my whole life put together? And you need guides. You need guides to be able to help you, people that have been there before, people that have seen it before, people that are professionally trained in this. Which is many of the people that have been sitting beside me these last few Wednesdays. So we've been talking all about the 3 T's, thoughts, traumas, toxins, right? The stress that gets stuck inside of your body. So thoughts, the emotional stress piece, gets missed by people all the time. And I'm sure you can even talk more on it, Shannon, but people just don't want to talk about their emotional health. Right. And then it gets stuck, and it's such a huge piece. So the patients in our office who progress really slowly, really sluggishly, the patients that are unwilling to unwrap what's going on are the ones that take the longest to heal. And we know that there's a piece stuck inside of them. So we talk about the brain all the time. The brain is neuroplastic. It's able to change and adapt, but it's constantly taking in information. And if that information is stuck in there and you're telling yourself the old nasty things over and over again, you're not going to get healthy.
Well, and the reverse is true, because I refer people to purpose-driven chiropractic all the time, specifically for anxiety and depression and mood disorders when they're stuck. Mm-hmm. Because there's something that's going on that I'm not equipped or trained to deal with as well. And so it's a complement, just like it is to go to an osteopath or a naturopath or to do a whole life assessment to really understand what's going on in your body that also affects your mind and vice versa.
Yes. Oh my gosh, which it is. It's been a perfect little marriage in getting people up over any hump that they need to so they can start living what we call an elevated life. Live the way you're supposed to live and have a great time doing that. So I met Shannon probably 10 years ago.
Almost 9 years ago.
She was doing a positive discipline workshop over at the Montessori. She does EMDR, so she's just been a wealth of knowledge. And now, since we've connected on a business aspect, just being able to help patients through the stuck, but then also in women's networking. So this woman, I want you to explain to them what you see, because we know kids. Right. 1 in 5 now have some sort of mental illness. Right. I'm sure the statistics are worse with adults. I don't even know. But tell us what you see and how you help people through.
So the most prevalent piece that I see is when people aren't taking care of just their basic physical health, what you're putting in your body, the kind of sleep you're getting, the vitamins you're not getting, too much exposure to electronics, and this is across the board. So one of the first things I do is I go through and I do a whole life assessment. We spend an entire hour plus taking a look and really deep diving into how are you taking care of your body. If you have set yourself up for stress, it's going to be really difficult to dig in, whether you're coming in for adjustments or you're working on the mental health component, and see rapid change. But the people that are willing to deep dive, I've got people that come in primarily with anxiety. That's the biggest one for adults and children. My stomach hurts, I'm not sleeping, I'm stressed out, I'm not communicating with my partner very well. The basics it comes down to self-care. And so what really happens is you can have big life trauma and you can have small trauma, but it's still trauma. So anything from someone having their life threatened or being in an abusive relationship or witnessing abuse in their family of origin creates trauma, to somebody called me a name when I was in 2nd grade. Sure. And that counts as trauma because our brain tracks that information.
Your nervous system never forgets.
It never forgets. Really, the way I describe it, and a lot of you that probably follow Christie on here has heard of the concept of flipping your lid.
I don't know if I've shared it. No, share it with them.
So the basic concept is, if this is the brain in the palm of your hand, and this is your frontal lobe, and this is your brain stem, when you flip your lid, you lose your impulse control, and you're operating on your amygdala.
Yes.
So most of the people in our society are operating off of their amygdala, and I joke about when people say, oh, that's a first world problem. I'm like, don't minimize that, because that first world problem is your saber-toothed tiger.
Oh, absolutely. So this is fight or flight response. For those of you who know our fight or flight response, that's a primitive response. We talk about gas pedal.
Gas pedal. So fight, flight, and freeze, and it's all based on primal survival mechanisms. And so one of the most important things is people understand that even their attachments in early childhood affect your amygdala. And it affects the kinds of negative cognitions that you referenced earlier, and the negative thinking and negative beliefs we have about ourselves, which taint every interaction we have and every relationship that we have. And so when people come to me and they're talking about anxiety specifically, you can have anxiety that stems from your amygdala, and that's when you get that physiological response. Your stomach's tight, your jaw's tight, you're panicking, you're curled up in a ball in a corner.
Heart rate's up.
Your heart rate's up, you think you're going to die. That stems from your amygdala. And that means that your sympathetic nervous system is on overdrive, and those are the people I send to you.
Yes, yes. You guys, I got to tell you how amazing Shannon is at picking up on this kind of stuff. And I'm sure people look at you like you're crazy. You've got to go to the chiropractor.
They go,
before we can break through.
Yeah. I'm really afraid of that. Some are resistant, but the percentage of people that are open to it are so done feeling that way that they'll do what they need to do to take care of their health.
Which is awesome. It is awesome. And so keep talking through it. Sorry, I didn't mean to interrupt you on
So I actually have your checklist in my office, and I give people copies of your checklist.
This is
the image of the spine.
Yes. So you guys are familiar with that. It's the brain. It's the spinal cord.
And you check the boxes based on what your symptoms are, and I'll say, mark these boxes and go into Christy Hafer. Do not show her what you marked until after your scans. And inevitably, it's going to show up on your scans.
Hilarious.
And they come back and they're like, oh my gosh! And so I explained that for the most part, anxiety resides in your neck, right? We all walk around like this. We all drive like this. We get upset with someone, we go like this, right? So it's all that tension, and it really is your system on overdrive. So it's the gas pedal, and the parasympathetic is the brake pedal.
Yeah.
And I describe that as people who are kind of apathetic or lethargic, and you can't get moving. Maybe you're
very
depressed.
Exhausted state.
Yep. You just can't. It's literally like someone's holding you down. And one of my best friends described it as suppression. Like you are being held down by some force that you are not in control of.
And for you that already are patients in here, it's that red box that we're measuring. We're looking at how far shifted are you right or left at a state of rest.
Right. So one thing that Dr. J has talked about with me, because I'm always just a little bit on the outside, he's like, listen, some of us just live there. Which is true. Like, I'm a high energy person, but
nerves that fire together, wire together.
And I just am a go, go, go kind of person, but I don't experience anxiety, and I like to be on the go. I like that energy. It's not a fight or flight response for me, because that's not my background, but I know what I need to do to take care of myself. And so one of the things is chiropractic. The other is mindfulness meditation. There's actually science that shows 30 days of 30 minutes a day mindfulness meditation. You actually can calm that system down in tandem with other types of self-care.
It's amazing what your brain can do when you try to just quiet.
Well, and you have talked about how clean my system is. Like, you can tell when you look at my scans. If I was not a person who took care of my body, I probably would go full tilt into anxiety. Right?
That's just more of those 3 T's. I'm putting more crap in my bucket.
Toxin. So the other thing I wanted to share was anxiety doesn't just come from your amygdala. So if your amygdala, I call it having your amygdala on fire, or you're cracked wide open. Like, you're literally running around like your hair's on fire because you just can't get to enough things.
We've all met those people.
Right. Yep. Well, some of us have been those people. Or we've been those people intermittently. And so the other way anxiety, for example, shows up is through your cerebral cortex. So the outer part of your brain, this is the neuroscience piece that I love to talk about and give people the education so they understand what's happening to them. So if your anxiety starts in your amygdala, you're definitely going to need more support from chiropractic care. If it's in your cerebral cortex, then what's happening is that's the part of your brain that gives you the possibility to think about thinking. And so right now you're thinking about how you're thinking about thinking, right?
Maybe.
And so what happens is your amygdala freaks out and your brain starts going to worst case scenario. And so what does that do? Then you get a physiological response and you tighten up, right? And so even if you live in a space where your moods fluctuate dramatically or you are depressed, your brain, your chemicals, your hormones are firing off, and then you're interpreting what that means about you, and you then reinforce all those negative belief systems.
Yes. So. That is your perception.
Yeah, your perception is your reality.
Yep, exactly. Yep. And that's probably, if you guys watched last week's video, we talked about that as well with someone doing neurofeedback.
Right.
And what they get.
Right. Yep. And she does NET, right? Is that what she does?
I'm not sure.
I thought she did NET also, but I was watching that one.
Yeah.
So it is your body has a response, and your body will store the trauma whether you're acknowledging it's there or not. I have an example.
Yes, that's what I want to hear.
I want to be careful about how I share this example because I want to maintain confidentiality, but someone came in, there was something going on in their personal life, and she had a fear that something bad was going to happen to her children. And what was happening had nothing to do with her children. It had to do with her living environment outside of her home, and she felt threatened. And I kept thinking, I don't know how to help this person except to give her tools to calm herself down or to seek legal assistance. And so as we were talking about it, I thought, wait a second, what is the negative belief you have about yourself when you're going through these things? And she says, my kids are going to die.
Oh. Ooh,
that's really scary, and it had nothing to do with that. And so when you think of the spectrum of the kinds of things that occur, she had something very traumatic happen to her related to her children 10 years prior.
Wow.
And we were able to make the connection. I said, listen, this is my theory. This is how your body stores the trauma. This is where it's showing up for you. Are you willing to do the trauma processing? And she's like, let's do that.
Yeah.
Let's do that. And we did it, and we keep talking even to this day. She called me yesterday about something, and she really acknowledges that it seemed so far-fetched for them to be related. But if you're experiencing something in your life and you literally ask yourself, what does it mean about me? People usually will say, it doesn't mean anything about me.
Oh.
But it does, or it wouldn't be
impacting
you, right? Yep. And so then that perception also feeds how your body responds physiologically. Because your body will interpret chemicals and hormones intellectually, although the chemicals and hormones are really just telling you to move and get out of the way of danger.
That's what we talk about. The physical body and physiology always match. Like you can describe someone that's excited.
Right.
Depressed, like you watch their physical body.
There's a really great image if you Google emotions experienced in the body, and it shows what it looks like and where the energy is for anxiety and depression and love, guilt, embarrassment, and it shows heat oriented images based on thousands of people that were studied.
Oh wow, that's amazing.
Yeah, it's really cool to look at. And I show people that because I'll ask them, where do you feel that in your body? Because your body remembers the sensation of that emotion, of that belief, of that fear or sadness or whatever it is. Your body stores it.
Sure does.
Right?
Sure does.
And so you'll find tension points in there. And so when I show them the images, they're a little surprised. Some people will say, oh, I feel it in my stomach, and we'll dig a little deeper. That isn't anxiety. The way they're describing it's actually anger.
Ooh.
Yeah.
That's interesting.
And so it's really important to be able to address the underlying feelings. And when you do something like EMDR, what the new research...
So this is her technique.
Yeah. So it's an intervention that really helps you to desensitize your amygdala to whatever the emotional responses are. And people walk out after doing EMDR and they'll say, it's subtle, but I just feel relief. Like I'm not getting triggered by those things. They see something coming up that normally would trigger them, and then what happens is they feel pressure, like I should have this reaction, or I'm going to have this reaction, I should be prepared, and it never happens.
That's so cool.
Yeah. And so when they do the brain scans, they do actual functional MRI brain scans on people before and after EMDR intervention, and it looks completely different. And so what they are now saying is that they're literally desensitizing the amygdala.
That is so cool. Oh my gosh, I love it. I don't know if there's a question on there, but is it true that weak areas of the body store emotions more predominantly, like where a specific trauma, sorry Jen, where a specific trauma has occurred. So you're talking about like a physical trauma in the body. I've noticed a pattern in family members. Well, I can tell you specifically that we see it show up definitely during the birth process, like we've talked about during, birth trauma in the cranium, cord wrapped and things like that.
Right.
Absolutely start to be, it's kind of like the weakest link. It's
Right.
usually what we would call a primary subluxation, where this is where it started and the body had to adapt around this insult.
Right.
How about
I
you?
would assume that that's the case because people will say, I don't remember much from my childhood. But the interesting thing is your brain actually remembers everything. It's just a matter of what you can recall or not recall.
Yeah.
And if you're not recalling a lot and you didn't have a lot of trauma, that's not a bad thing. That's just meh. It's kind of meh, not a big deal.
Maybe
And if you had a lot of trauma and you're not remembering, then a lot of people don't want to do that work because they don't want to feel it and they don't want to remember it and they don't want to look at it. But then when they actually do, I've had people literally sit in my chair and they're like, I don't want to.
Yeah.
And by the end, they're like, I'm so glad I did.
Right.
And I have one woman, she's awesome. She works her butt off. And she says, I'm starting to hate coming in here because I just don't want to feel this way. And I'm like, but you feel good when you leave.
Exactly.
So,
exactly. Yeah. And Shannon works with a lot of, I remember you telling me it's like 30-year-old women, especially business owners, business professionals with a family trying to keep it all together.
Trying to create balance.
Yep. That is absolutely not a thing. So
It really
it's
is
never going to happen.
Stop
So
lying to yourself.
right?
It doesn't exist.
Check that out the box. It's not going to happen. Which is awesome. Awesome. And she's got a class coming up on relationships.
That's
a
right.
Weekend retreat.
So it's a
tell them about
weekend
that.
retreat, and it's based on Gottman's 7 Principles for Making Marriage Work. And I actually went and did the certification training for it because they have 40 years and thousands of couples that they've researched. And so it's a weekend kind of date night style. So you show up on a Saturday morning and we do some education, and you have actual date night, and you stay the night in a hotel, and you really connect around the material, and then you come back the next day and work harder. And people had really great things to say about it. So I don't have a date, but if you're interested in being on the list for it, you can feel free to email me, or do you want them to message you
No,
first?
they can send you a message because we'll tag Shannon in the comments.
Yeah.
And I also have her information, of course, at the office. If you're a current patient, you can grab it that way. Because especially if you that are married, or even if you're in a strong relationship, can attend this event because that person should be your partner. Right. And not your enemy.
So I talk to people about it's a relationship retreat for people who are strong or struggling.
I love it.
Because it really creates depth in the relationship. And we talk about the 4 horsemen of the apocalypse of relationships, which is really vital because it's things like stonewalling and defensiveness and contempt. And so you get a deep dive education into what that looks like. And then it's in a group setting. And so you guys should actually
Cool. I'm going to go.
So it's in a group setting, but it's a couples only experience. So you get your own table with your own partner. Men really appreciate the fact that they don't have to do group exercises or get up and speak
it out.
I don't even care if you ask questions. It's great. Yeah. It helps me not have to talk for 2 days straight and listen to my voice. But you do not have to interact with anybody while you're participating. That is really about your couplehood and creating a deeper emotional connection.
That is fantastic. I love it. Learn how to, fight right.
Right.
Because
everybody fights.
They do. And that's what they say. You're going to fight with somebody. So pick somebody you want to fight with for the rest of your life and do it the right way.
Do it the right way.
You need to do it. And women that are watching, we have got our women's event that's coming up on May 18th. Empower Women. And if you need to come get your cup filled, connect with some women, connect with some moms, and just have some refreshing time, I'll post that in the links as well. And then you guys stay tuned till next week's Connected series, which is going to be about removing toxins in the body, liver detoxes and things like that. And we will have a whole program. It's super cool that this Ari Carlson has this whole deal set up that you can just join a Facebook group and follow what they do.
I love someone.
Yeah, absolutely. So thank you for coming on.
Thank you for having me.
I appreciate it. We're going to post her contact in the comments. And you guys have a wonderful evening.
Good night.